Hi, everybody. This is Kathy, Ann, and Jennifer with Deception in Healthcare in America. And today we're talking about something it's almost kind of silly, but not really, almost angering, but kind of funny at the same time. It's how much time you've spent in the waiting room. So there's a lot of different aspects to it. How long you sat inside the waiting room waiting for your appointment, how long you sat in that second room while you're still waiting for your appointment because the doctor hasn't come into your personal room, and how long it actually takes to get an appointment to see a doctor. So there's a lot of aspects to waiting for a doctor. So I did some research, and you know what? We don't even hardly have to do research on this because we all know how frustrating it is. But this is the average time a patient spends inside the waiting room, and it says it's 13 minutes. So that's not my reality, but according to this study, that's the reality. And then after being called back to the exam room, the patient usually waits another 10 minutes to see the doctor on average. And the average appointment lasts 20 minutes. So if you've waited in the waiting room for 13 minutes and then in the exam room for 10 minutes, you've waited longer than your appointment. And so that's very frustrating.
It is. It's frustrating and it's interesting. So the statistics line up with my experience with like my main physician that I usually only go to once a year. He'll check all my vitamins and stuff for me because my endocrinologist says that's beneath him. He doesn't do that. He won't check cholesterol or anything else. He'll only do like my A1C, my free T4 and all that stuff. And then he's just kind of like, okay, get out of here. But with my regular physician, those statistics that you just read off, I know for me, my husband, my daughter, that pretty much, that's what we experience. As far as after we see the doctor, it seems like they are pretty quick, unless you just really want to get into a conversation. It seems like it's like 5 minutes with him. I want to say like 3 to 5 minutes, unless he says you just have a concern, or he'll take any questions you have. But I don't think I've ever spent more than 5 minutes unless there was something I was really, really trying to like have help with a solution or try something new or get an explanation on something. I mean, he'll give you like, I know he's given me like at least 20 minutes before, like he is very considerate. He's not dismissive or anything like that. It's just he's if you let him and allow him, he's very quick and to the point. But now my endocrinologist, oh, I'm gonna wait 30 minutes to get back there. Then they're gonna weigh me, and then they're gonna put me in a waiting room maybe for another 30 or 45 minutes.
Oh
Oh,
my
this is,
gosh.
yes, every 3 months now. So, and all I have time to do is sit there. And once you go in his room, he's got normal A1Cs. He's got these charts. He's got the new pumps that are out and why you want to pick these. And you're just sitting here, and, I come in and I'm fine. I'm good. Then by the time the nurse comes in and starts asking me, do you want a flu shot? Have you had a flu shot? When was your last AKG? They always ask us that as a type 1. I don't understand it. Then they want to know if you had any vision changes. Have you gone to see the eye doctor? Then they take your blood pressure and it's like shitty, okay, which my blood pressure usually runs like 115 over 60 something. That's any given time of day. Even when I'm sick, like mine never really changes much, right? That's one of those things that I just don't have any problems. But that's high. And then they're like, well, we need to come back and check it again. You can't leave until it comes down. I'm like, well, I'll be here. I'll be here as long as, I'm looking at you guys. It's not going anywhere. Like, it's going to stay here in the room with us until you guys let me go, and then I'll be fine. Honestly. Then I start getting a headache. It's like all this anxiety builds up while you're sitting in the room waiting on them. And then they come in there and while they ask you a million questions. And it's like, by the time the doctor comes in, your cheeks are red because now now my head, I like have this pulsing headache, and it's every 3 months. And so now my new thing is when I pull up, I'm just not going to get anxious. I'm not going to whatever, but it's like just a simple fact that you're about to be grilled. But it's like my regular doctor is like in and out. So I don't know how that happens, and then you wait a really long time. And I think that's part of the anxiety. They just leave you sitting there.
Yeah, I think
Right.
it is. I think because you think after like 10 minutes, you think they forgot about you and you're like, should I go peek out the door? And then you start wondering, did they forget? Did they forget? Should I go ask somebody if they remember that I'm here?
Or
Because
should I
that
go
happens to me.
quick? Because now I have to go to the bathroom. I've already sat outside for an hour freezing, and I already have like my bladder is already whatever, tiny. And I was sitting out there drinking water, or I had 5 mugs of coffee before I came in here. Should I hurry and go use the bathroom? And you look at it and you peek, you go use the bathroom, you come back and they're like, well, he came in there, but you weren't there.
Yeah.
You know?
You know, that's funny that you say that because I actually, if I have a doctor appointment in the morning, I won't drink coffee because that whole thing with then I'm going to have to ask to use the bathroom because I've waited so long. So I had an appointment today and I did not have coffee because I was afraid I was going to have to use the bathroom.
You're strong. That is strong willed. Boy, that is I'm not giving up my coffee. They'll just wait on me.
So yeah, I mean, for me, my PCP, so I usually don't. So I would never see a doctor, but because I was injured by a chiropractor, I had to see a lot of doctors. And so the wait time for me ranges, but for my PCP, I'm in pretty quick, like within 10 minutes. But my dermatologist is the worst. I can easily wait an hour for my
So
dermatologist.
so it's a
And
special thing maybe.
so I've considered switching because the wait time is so awful, but I really like my dermatologist, so I'm not. But there was one time I was almost late for my appointment, and they gave me a really hard time because I was like 14 minutes late, and at 15 minutes, they cancel your appointment. So they gave me a lecture about their next time they're going to cancel my appointment and charge me $25. And I thought to myself, 15 minutes late, you cancel my appointment and you charge me $25, but you easily keep me waiting for an hour and there's no repercussion for you. The only repercussion is if nobody would go see, but she's so good that she's actually super busy. But do you see that there's no repercussions for them? They can make you wait an hour and there's nothing that can be done. But for you, they're going to charge you $25.
No, and I feel like the outlook on they do this enough. This isn't a doctor who just came into practice or something. This doctor's been here 5, 10, 15, 20 years, whatever. They kind of should have a pretty accurate outlook on like expectation of, about how long someone's going to sit because that never changes. As you're well saying, we're both sitting here living in two different cities saying the same type of thing other people I've talked to or heard gripe or whatever, which is why we're doing the podcast. This is something everybody talks about. Like you kind of talk about it, but you don't, or whatever. Like it's talked about without too much thought. I think it's just conversation.
Yeah.
Especially once you get in the waiting room, that's when you start talking to people and complete strangers, and you'll ask them. Like on Black Friday, we went in. Me and my daughter never go out and buy coffee. Well, we were out, and I was like, you know what? Let's just jump in with the whole experience and go grab some coffee. Well, the nearest thing was Starbucks, which I hate Starbucks. I don't like I like it. That's not what I would choose. I like people that like the smaller shops like you. Like if I come and meet you and we go to an actual place where the coffee is not whatever, Starbucks. I get sick of Starbucks. But anyways, we went in and we waited 45 minutes for a coffee. So while you're in there, like you turn to somebody and you say, hey, about how long have you been waiting? Well, I don't know about you, but I do the same thing in the doctor office. And most people have it's like the same response, the same number. I don't hear anybody say, oh, I've been here an hour. Or now if I go to the endocrinologist, they're like, I got here an hour and 12 minutes ago, man. These are usually older people in endocrinologist office. Nothing against older people. I'm just saying, like, I'm usually one of the youngest people in there, and I'm 46. But I mean, I kind of feel like I'm 18 in a room. It's like back in the day when you go to the doctor, there's a bunch of 30, 40, like a bunch of moms and dads, right? Well, I feel like there's a bunch of grandmas and grandpas in there, even though I'm a grandma. But I feel like there's a bunch of grandmas and how long did you wait? And Kathy, and I'm not kidding, they'll be like, I've been waiting an hour and 12 minutes and 32 seconds. He does this every time. Now he knows he's got a bunch of staff back there because he has nurse practitioners. There's 4. He usually has 3 or 4 nurse practitioners, and there's always 2 there. I don't know if the other 2 help him at the hospital. So a lot of people get frustrated and say you have all these basically because they step in as a doctor. I don't think there's a whole lot of difference. They even do prescriptions and order the labs when you get back there. And I only see him once a year. So it's like, what are you guys doing? I don't know. Because you look around in the waiting room and there might be 5 people. And I know I've seen as many as like more than that. I've seen every chair full where there's people start getting irritated and go tell her, I'm going to go sit in my car. Will you send someone to get me? And they say, no, you have to come back and check. Then these older people have no filter. They just all there get up and care, walked out the door. They don't care anymore. Their give a damn is busted. Anyway,
I don't blame them.
so yeah, but I mean, I go in every 3 months, so this conversation is kind of really funny to me. Like with you, you've had to go to the doctor so much in the last 3 years? Has it been
Mm-hmm.
3
Yeah, I'd
years?
say almost 3 years.
Well, this has been my life now, I guess. I don't know. I go every 3 months. It's like you do at some point, you're like, you sit back and you say, look, I'm a part of this system. And you just kind of sit back and laugh, I guess, as you can. It's like, I'm not going to allow this to ruin my day. But then, like you said, sometimes you get in there and it's like, are you kidding me? Like, it just doesn't make sense. And then you guys are going to say something to me, and I come in here, I don't know, however often you come all the time, enough where they remember your face. They say, oh, hey, they're like really super friendly because they may not even remember your name. But they do remember your face because you're a kind person. You treat them kind, so usually they respond more kindly. They're. But it's like you see me enough to know I'm not a problem. I'm not a problem child. I'm not one of those that cancels, doesn't show up, whatever. And I just literally happen to walk in late. Like you know, it's like a teacher. You know which ones are the problem children. You just kind of let some things go sometimes.
Well, I thought at my dermatologist, since they treated me that way, I thought I should go up every 15 minutes and remind them that I'm here. But I think maybe I have to be
Sounds like
20 years older to do that when I just don't care
that
anymore.
sounds like. Yep. I've seen some people really act up with the receptionist, and I just say, oh my goodness.
Well, the receptionist does get the brunt of it. It never filters down to the doctor. The doctor they'll probably get put in the exam room. The doctor comes in. They're like, "Oh, hi, Doctor So and So. I'm happy to see you." And meanwhile, they
And
just reamed the receptionist.
that poor those it's usually young poor girls who are very inexperienced, but like there's inexperience and they don't know like what they're really sitting down for. And as they start learning, and I'm sure weeks and months go by, you're like, oh, she's not as sweet as she used to be. Ha,
Yeah.
well,
Because
I mean, I can only
yep.
imagine. Whew, even
Yeah.
at the office, when I go to the dentist office, I know the lady there, it started out, hope she doesn't hear this, but when it started out, it was like she was so rude. I was like, oh my goodness. And as we had just found this lady. It's a private practice, so it runs completely different. So it's like the treatment is different, everything is different. And it's like, oh, so we really like it. So we go in and we stay on top of it and go in. But I looked up why the wait times existed as far as like when you actually make an appointment. It says the average wait time, this is not everybody, you guys, but the average wait time, like to make an appointment and to actually wait on it to get here, is 30 days in the United States. It goes as high as 2-3 months in other countries. So I guess we're on the lower end or whatever. We're not even in the middle. We're just kind of on the lower end. Like in Spain, they wait like 77 days or something on average. Like it's really hard to see a doctor in Spain. The UK, I think, was 50 something, 52 days. It says that just across the board, this is caused by the growing gap between the demand for physicians and their availability. And like Kathy Ann and I were talking about, which kind of circles back around to insurance, we are on a shortage of physicians because they are walking away from the profession. They are using their degree to do more specialized or other things, and we're losing what Kathy Ann keeps referring to as a PCP. For those of you that don't know, that's your primary care physician, and they're walking away. They are walking away. I mean, the things they are dealing with and putting up with, I think it started right before COVID. It was like a couple years before COVID. From then to now is just, it's grown. The problem is even worse.
Yeah. Physicians having to deal with insurance companies. I think that's like the biggest factor in our healthcare system. Why we have a doctor shortage, why we don't get proper care, why we just get that 20 minutes because the doctors have to fit in X amount of patients per day
Hmm.
to get money because of the insurance company.
Right.
And it's just like I think they want to help you. It's just that they're limited because they're limited with their time and the billing and the coding, and it just sucks. They can't practice the way they want to practice. So
They're doing, they're walking away. That's what I said. They're specializing in other things, or they're using their medical background and degree to pursue something in the medical arena or whatever. But, and it is
yeah.
like a scary thing to think about. At some point, we're going to get to where, um, the cost of seeing a medical professional, holistic or not, people think holistic is so expensive. Like you and I know we do some holistic things. Or like I see a private practice dentist and our insurance pays, they won't pay for anything but a free cleaning every year. Everything else comes out of our pocket. So like that's kind of how holistic care is the same way, but it's like that's kind of where things are going because people have more control over how their practice is run or whatever it is that they're doing. I mean, when you're running your own business and you have more control, but when the government is like stepping in and They are setting these guidelines that you have to follow, where they're going to slap your hand like so hard. Their hands are tied. Yeah, I don't think you're getting the best of those physicians either, because the stress, I wouldn't want any of it personally. I think they're amazing. First of all, I know they come out, they just want to help people. And I think most every physician, um, at the core of their desire is to come and help for whatever reason, whether their mom had cancer or their little baby sister died of this, or they've dealt with some disease their whole life, or whatever is behind it. It's usually because they want to go help people. They feel like they can make a difference. And then they get out there and it's like, well, here's the tiny little box you can operate in. Now figure out how to do that. You know what I mean? And then they're
Yeah.
regular people, like you said, they have a husband or a wife, they have children or they don't, or they're caregivers of maybe their parents or siblings, or I mean, you don't know. Like
Yeah.
people have
So,
regular lives too on top of that.
so for me to see my primary care doctor, I am having to wait 6 months because she's so booked up. And also, I had to see a vascular surgeon for thoracic outlet syndrome, and I had to wait 9 months to see the vascular surgeon. So I'm experiencing high wait times for having to see my doctors. So that was our podcast for today about waiting times in the doctor's office. And to recap, the average patient spends about 13 minutes in the waiting room, and after being called back to the exam room, they wait about 10 more minutes for the doctor. So that's about 23 minutes of waiting. So if your appointment lasts 20 minutes, then you've waited longer than your appointment actually is. And for some of us, we wait more, like I can wait up to an hour to see my dermatologist. Some of us may wait less, but we're all waiting. And some of it's not necessarily the doctor's fault. Our healthcare system perpetuates this in a way because we are in a traditional model. And by that, I mean that your doctor relies on insurance reimbursements to generate money. So this structure rewards doctors for seeing more patients per day and not spending more time with them. So let's say that they're all booked out for the day and one appointment goes 10 minutes over. That means they're going to be late for their next appointment, which means they'll be late for their appointment after that. And it's just going to snowball out of control for the rest of the day. So there's really nothing we can do about that. You know, we just wait for everything. We wait at the red light. We wait in line at the restaurant. We wait in line at the grocery store. It's just one of those things that we have to do. We're just waiting. But I hope you enjoyed our podcast, and we'll be back with another episode with another topic, and we'll talk to you then. Bye-bye.